Good afternoon.
Hello.
Hi there, Mr. Nordine. How are you doing?
I'm good.
Good to see you. My name is Tina, and I'm your nurse practitioner today, and I'm coming in here to do your neurological assessment. So just wanted, before we get started, I want to make sure that you do consent to me allowing me to do your assessment today. Do you consent to allowing me to do that?
Sure.
Very good. Well, before we get started, Mr. Nordine, I just wanted to get a little bit of a history. Can you tell me, first of all, why you're here today? Is there anything that might be bothering you? Any symptoms that you might have that you'd like to share with me?
Well, my eye.
Okay.
It's got a spot on it that's swelling.
Okay. All right. I understand that's probably quite frustrating. So
Yeah.
I'm going to make sure that we assess that today and see what we can do to try to fix that, okay? So, Mr. Nordine, before I get started, like I said, we are going to do a neurological assessment. I've got some supplies here behind me over on my table, and I just wanted to let you know that I'll be back and forth to get my supplies for you. Part of the neurological assessment, there's 5 areas that I want to talk to you about: the mental status, your speech, your coordination, your cranial nerves, there are 12 cranial nerves, sensory, and then your reflexes. And don't worry, I'm not going to forget about your eye as well. Okay?
Okay.
So before we get started, I'm going to first do what's called cranial nerve number 1. That's the olfactory. And that's a big word for seeing if you can smell pretty well. So what I'm going to do is I'm going to ask you to occlude or hold your finger over one side of your nose, and then I want you to see if you can smell this. What does that smell like to you?
Minty or something. Maybe.
Minty. It's a peppermint flavor. That's correct. All right, Mr. Nordine, and I'm going to ask you to occlude that other side and see if you might be able to smell this. And this might not be a familiar scent to you, but are you able to smell a scent there?
A little bit.
Yes. A little bit. You are able to smell it? There's some passage of the smell into your nostril? Okay, well that smell is called lavender, and I know that's probably not a scent that you're quite familiar with, but that's, for us, the cranial nerve. What we want to do is check number 1, your cranial nerve number 1, to make sure that you're able to smell through both nostrils. All right, so you did good on that one. So we're going to go to now the optic nerve, or looking into your eye. And so what I'm going to do is I've got this ophthalmoscope. I'm going to turn it on. There's going to be a little light that you'll see. And I'm going to hold this up to my eye first, and I'm going to come in at a 15-degree angle, and I'm going to look at your eye. And what I'm going to do is I'm going to try to look at the back of your optic nerve behind your pupil on that side, and then I'll come over on this side, and I'll do the same. I'll first put it to my eye, coming in at a 15-degree angle, and look at behind on your optic nerve on this side. You look pretty good there. I do see where you have some trouble there on your eyelid, so we'll certainly assess that and see if we can treat that too before you leave today, okay? All right.
Thank you.
You're very welcome. So optic nerve, or cranial nerve number 3, is the oculomotor, which involves the pupillary reaction, your pupils in your eye. It's probably something that you're pretty familiar with. It's where your pupil constricts and contracts. And so I'll be able to see if your oculomotor nervous system is intact. So let me do that real quick. I'm going to turn the light back on. And actually I'm going to use a different tool this time. This also will be a light, and I'm going to look into your pupils to make sure that you're able to constrict that eye and not. And I'm going to do it over on this side too. And I'm going to make sure that not only am I looking at the eye that I'm placing the light on, but also the consensual eye to see if there's constriction. Okay? Very good. All right, so, and what I found was that they were equal, round, and reactive, which is normal. Okay? So cranial nerve number 4 is the tracheal. That's a big word. And what that means is the 6 cardinal fields of gaze. So what I'm going to do is I'm going to ask you to follow my finger in 6 different directions, okay? So if you'll not move your head, but just follow my finger with your eyes. This way, and down, over this way, up, and then back over to the middle, and in. Very good. Looks like your field of gaze is very reactive as well, and your cranial nerve is intact. All right, very good. So cranial nerve number 5 is the trigeminal nerve, and that looks at your sensory and your function, part of your motor function. So what I'm going to do is I'm going to hold my hands on your jaw, and I'm going to ask you to move your jaw from left to right. Can you move your whole jaw from left to right? There you go. Okay, so you do have motor function there. Your trigeminal nerve is intact. And I also have a cotton Q-tip. On one side is a soft side, or a soft cotton side. The other side is a dull side. So what I'm going to do is I'm going to place this on your cheek, and you'll tell me if it's soft or dull. Okay? So here's this.
Soft.
That was soft. And then on the other side, I want you to feel this.
Soft.
Okay, very good. And
that was pretty soft.
it was pretty soft. Okay, well very good. I think that you have a cranial nerve intact there. That was the dull side. I probably didn't do it quite so hard. I didn't want to hurt you. But I do believe that your cranial nerves are intact, so I don't have a concern there. All right, so Mr. Nordine, the next cranial nerve is cranial nerve number 7. It's the facial nerve. And what I'm going to do is I'm going to ask you to smile today. And if you can frown. Okay, all right, you're able to do both. And then can you puff out your cheeks like you're blowing into, there you go, very good. So it looks like your facial nerve is intact as well, so very good. You passed that one. And then cranial nerve number 8 is the acoustic. And so I'm going to make sure that while we're having a conversation, I haven't heard you say huh or excuse me, repeat yourself. So I believe that your cranial nerve is intact, your acoustic cranial nerve is intact, because I've kind of assessed that when we were talking and you were talking to me and you were able to hear me pretty well. So very good. If I were to also assess you, what I would do is I would ask you to occlude one ear, and I would do what's called a whisper test. And I would use a 2-syllable word and see if you're able to hear that.
Baseball.
Very good. If you can occlude this ear, can you repeat this word?
Apple.
Okay, very good. All right, so I believe that your cranial nerve is intact, your acoustic cranial nerve. So now, next I'm going to do what's called the Weber's test. And this is when I use a tuning fork to the middle of your forehead, and you'll let me know if you can hear it within your ears, okay? So what I'll do is I'll strike the tuning fork. Are you able to hear that? Let's see. This is new to me as well, but I'm definitely going to ask. No. Okay. Well, we'll move on from there. And we'll see if we can get some assistance with how to use the tuning fork in the future. Very good. So the next cranial nerve is cranial nerve number 9. It's the glossopharyngeal, another big word for you. Also the vagus nerve, and that's the ability to test how you swallow, how your palate moves in your mouth. And so what I'm going to do is I'm going to change my scope here so that I have a little bit of a brighter light, and place this here, a little bit brighter light. I'm going to be able to look into your mouth and look at your soft and hard palate, make sure that your uvula is midline. And what that's looking at is to see if you have what's called dysphagia. Many patients with strokes have dysphagia, so I want to ensure that you don't have that. So if you'll open your mouth, sir, and stick out your tongue, and if you could say, ah. Oh, yes, I see your uvula back there. Okay, very good. You did good. And I see that your soft palate is moving, your hard palate is intact as well, and your uvula is midline. So, again, your cranial nerve is intact. Did you bring your son here to the doctor's office to visit today as well?
I did.
I see him right there. I bet that he keeps you super busy on a day-to-day basis.
Definitely.
So, very good. So, very good. Well, what we're doing, young man, is we're looking at cranial nerves, and we're looking at a neurological assessment of Mr. Nordine. So,
And his uvula.
that's right. We looked at his uvula. So the next test is the accessory test, and this shows resistance and if you have motor skills. So I'm going to place my hands on your shoulders, and if you could lift up and down and up. So it looks like you do have motor skills there. I'm going to place my hand on your cheek here, Can you turn your head to the left and to the right? Very good. So you do have resistance there. That means that your cranial nerve number 12 is intact as well. That's the that was cranial nerve number 11. That's your accessory cranial nerve. The last one, cranial nerve number 12, is your hypoglossal cranial nerve. So again, we're going to do that time out again, and I'm going to turn my light back on. If you'll stick your tongue out. Very good. And what I'm looking for here is if your tongue is deviated to the left or the right. In a patient with a stroke, it would be deviated, or someone that has, you may place your tongue back in. So if your tongue were to be deviated in one way or the other, that would indicate which side your brain was affected in an injury. So they use the term lick your wounds. So if you had a injury to the left side of your brain, your tongue would deviate to the left. If your tongue were deviated to the right, that would mean the injury was to the right. So just wanted to make sure that you had that. So next, so that's the end of your cranial nerve assessment. Next is your motor nerve, your motor assessment as well. And I'm looking at coordination. So one of the things that I did was I watched you as you entered in the room earlier before the video started. And in that, I made sure that you had coordination and gait and good posture. And as you're sitting in your chair, you're a little slumped over, but I think that you're just comfortable today. So I think that your posture is intact. I did look at your gait. I'm looking for any involuntary tics, which I haven't really seen any involuntary tics or anything. And I'm looking for any muscle atrophy. I'm looking in your larger muscles, like your biceps, your triceps, your forearms, your legs, your quads. And you look as if you were a very healthy young man, and look like you take very good care of yourself as well. So that was your motor assessment. The next part of the assessment is just the passive range of motion, and that looks at muscle tone or muscle bulk, to look if you're rigid or spasmodic. So patients that have Parkinson's, which you don't have, they would be more rigid and spasmodic. Someone that had less muscle tone, you would be able to, it's mostly a subjective matter that I would look and see. You look, to me, subjectively, you look very healthy. If it were someone that had a very flaccid tone, they weren't able to keep their upper body upright, I would be of concern. I'm not concerned about your motor skills at this point. I'm going to test your muscle strength. If you can reach out your hand, how about, and let's put your fingers together, and don't let me separate them. Okay, and then separate your fingers, and then don't let me place them back together. So very strong, you're very strong in your hands. And then in your wrist, if you can make a fist, place your palms down. Don't let me place your hands down. Very good. And don't let me place them up. Very good. So your wrists are very strong as well. Shoulders. If you'll place your arms straight out, very good. And don't let me press them down. And up. Very good. So your shoulders are very strong. That tests flexion and extension, abduction and adduction. Okay? And then I'm going to look at your knees, and I'm going to try to pull, if you'll just lay your leg back down. Don't let me pull it up. And push up. Very good. And push up with this leg, and back with this one. Okay, very good. So what I'm looking for here is to make sure that they're equal in strength, and that you do have no flaccid tone, that you're very strong in that, so your legs are very strong as well. We don't have a bed today or a stretcher for you to lay on, but if I were to have you lay down, we could test your hips strength as well. We could test your knee strength as well. At this point, I don't have a concern about your muscle elasticity or your tone, so we will skip on to the next section of the neurological exam. So, Mr. Nordine, what I'm going to do is we're going to do a coordination exam now. Could you stand? And I'm watching for your posture and how your gait and everything. And then turn to the side. If you can close your eyes and extend your arms out forward in front of you. And here I'm just making sure that there's no sway, no differences in what you're doing. And then if you can now You may open your eyes and place your arms down. And then now, if you will, this is called the pronator exam. If you will close your eyes, place your arms up. I'm going to briskly push your arms down, and what that shows is that you have returned. You can open your eyes and you may sit back down. And what that shows is in that I briskly put your arms down and you were able to push them back up to the original position. I looked at your gait. You're walking back and forth. And now I'm going to ask you to stand up again. Sorry. I'm going to ask you to walk maybe 3 steps that way, heel to toe, 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 and then backwards, and then come towards me. And then if you can go on your tiptoes, 3 steps, 1, 2, 3, very good. And then if you can come back and do a shallow knee bend, Mr. Nordine. Thank you. Okay, very good. All right, so you may sit down again. I'm going to now test another part of your neurological exam. What I'm going to do is I'm going to do a hand slap. I'm going to ask you to hand slap, and then back, like that. Back and forth. And then can you do that in rapid progression? Front and back and front and front and back and front. Very good. Okay, so that is intact as well. So that is the sitting rapid alternating movement. And then what I'm going to ask you to do is the point test as well. So I'm going to point my finger here. If you'll take your finger and point to that and then go to your nose. And here. And go to your nose. Very good. Okay, so you've able to do that. Now, Mr. Nordine, I know that you wear shoes. I think in an earlier assessment you shared with me that you have plantar fasciitis, so you wear your shoes in the house as well. So I'm not going to ask you to take your shoes off today because I don't have any concerns that you might have diabetic foot. But what I would do to assess that is I would take my soft side and my dull side along the bottom of your foot and make sure that you're able to feel those sensations. And that's another area of the neurological exam that we want to do, is to feel the sensation of a dull side and a sharp side. And that, again, would be for patients with diabetic foot. All right, so to continue on with the sensory exam, stereognosis, I'm going to ask you to close your eyes, and if you can close your eyes, and hold out one hand, and can you tell me what that might be?
A coin.
A coin, very good, okay, very good. And then hold out your other hand for me, and if you can tell me what this is.
A paper clip.
Correct. Okay, very good. All right, and while your eyes are still closed, I'm going to ask that you turn this hand over, and I'm going to write a letter in your hand if you can tell me what that letter is, okay?
H.
Okay, very good. Okay, you may open your eyes again. So with that was called graphesphasia and the stereognosis. If I'm going to close your eyes and I'm going to point to something, and if you can, after I point, you'll open your eyes and tell me where I've pointed. Open your eyes and show me where I've pointed. Very good. Okay, so that is the point localization. Now I'm going to use what's called the 2-point discrimination test. And on this, I'll have 2 points of a paper clip, and you'll tell me if you can feel 1 or 2 points. Okay, can you close your eyes? Can you feel 1 or 2 points?
2.
Okay, and? All right, and here?
1.
Very good, and here?
2.
Okay, very good. So open your eyes. Generally speaking, in this particular exam, in your upper extremity, you can feel 2 points. In your lower extremity, generally speaking, because of the way that our body localizes and our neurological system works, you can only feel 1 point, even though I touched you with 2 points. So it's just something to understand, but I don't feel that you have any deficits in your neurological system based on those factors. All right, so the next exam is using the reflex hammer. It's probably something that you've had done before. So what I'm going to do here is on your brachius. And I'm going to check this brachial nerve. Okay, very good. And then triceps. The tricep is somewhat hard to do because it's hard to get into the right position, but I'm going to hold your arm here and then, yes, and you're supposed to do it very gently, not hurt your patient. So, my apologies if I have hurt you. Okay, very good. We won't do that anymore. All right, and then of course the patella. Let's see, you'll just relax your knee. And we'll look for, okay, very good. And then we can also do the Achilles down here behind your foot as well. Okay, so we looked at the deep tendon reflexes of the brachial radius, the biceps, the triceps, the patella, and the Achilles. And then at this point, if we had a bed for you to lay on, I could also look at cutaneous reflexes of the abdominal area. By laying down, I would also use my end of my hammer and stroke from the umbilical cord outward, and we would see if you had a reflex there. And then also finally, for the neurological exam, we would look at the Babinski reflex. Probably heard that with children or infants in the past. What I would do is I would take my the bottom of my reflex hammer and go from your heel up and see if you would have a reflex of your great toe or of your toes to see if they would pronate there. So Mr. Nordine, I know that you discussed with me earlier that you had some concerns with your eye. Can you tell me a little bit about what happened with your eye and if you've had some treatment from it?
Yeah, not sure what happened. It just started swelling, and I've been putting eye drops in it.
Okay.
And it's better, but it's still there.
Is it improving?
It seems to be.
Okay. So what we will do is, did you tell me that you saw an ophthalmologist for that? What I'll do is I'll make sure that you have an appointment there to follow up with him. If you have any continued problems, if you're not able to visit with your optometrist, make sure that you do call my office back and we can follow up with you. It does look like it is a little bit red and inflamed, but it does look as if it is improving. So if you're not having many symptoms from that, we will make sure that we'll let him follow up with you and then bring you back if you have any issues, okay? So that's the end of our neurological exam, Mr. Nordine. Do you have any questions for me?
Did you say I had Parkinson's?
No, that's a very good question. I appreciate you asking me that. And so what I did was I had mentioned to you that if you had any tone rigid, if you were a rigid form of your muscles, that you may have Parkinson's, and you did not. So you were very normal. So my apologies if I have confused you. I don't mean to do that, but no, you do not have Parkinson's disease. We'll certainly continue to monitor you for that. Do you have a history of Parkinson's in your family?
No.
Okay. All right. Well, I appreciate the time, Mr. Nordine. I look forward to seeing you very soon. I believe that we have another exam coming up very soon that we have to do as well. So I appreciate you sharing with me the neurological assessment. And I hope you have a good afternoon. Thank you.
Thank you.
You're welcome.